Climate change result in mosquito-borne diseases, right from malaria to chikungunya to dengue and now Zika. We'll see all of them happening with much greater frequency. We also will see waterborne diseases because of extreme weather events. People are getting very sick or even dying from heat.
Welcome to this episode of Sustainability Karma. I'm your host Rajiv Tikoo. Today we talk about climate change and healthcare. In today's episode of Sustainability Karma, we have with us Prof Srinath Reddy. He is the past president of Public Health Foundation of India and former head of the Department of Cardiology at All India Institute of Medical Sciences. Let's welcome Professor Srinath Reddy to this episode of Sustainability Karma. Pleased to have you on board.
I'm happy to be here, conversing with you and through you to several others who may be listening in.
Your book, Pulse to Planet, it advocated for a holistic approach to health. What are the low-hanging fruits?
I would place a lot of emphasis on primary health care. It is absolutely important for us to recognize that that is where most diseases can be addressed, right from prevention and positive health promotion to early detection, effective care, referral as needed, so that you do not allow diseases to develop to a state of severity where people will have to go to hospitals at a considerable distance and a considerable expense. And that will actually burden people as well as the health and financial systems of the country. So investments in health are absolutely necessary. Recognizing that some level of advanced care is also required, we do need to invest in our district and medical college hospitals and make sure that secondary care is available and some elements of essential tertiary care are available.
Global warming is set to continue as things. How would you advise people take care of their own interests at their individual levels?
Well, global warming will result in a number of health problems. People are wilting in that heat and getting very sick or even dying from heat. We also know that global warming and climate change result in a number of vector-borne diseases, especially mosquito-borne diseases, right from malaria to chikungunya to dengue and now Zika. We'll see all of them happening with much greater frequency. We also will see waterborne diseases because of extreme weather events resulting in floods, water contamination, or extreme heat resulting in droughts and water scarcity. And we also recognize there will be a number of other health problems, whether it is strokes or heart attacks or mental health problems, renal failure. And we also know that it's likely to affect agriculture and food systems, resulting in nutrition insecurity. So what I would say is, first of all, in terms of facing up to the challenge of extreme heat, make sure that people do not expose themselves to extreme heat for long hours. And if they have to, for whatever reason, occupational reasons, then they'll have to protect themselves by wearing caps, wearing eyeglass protection, wearing loose cotton comfortable clothes which allow ventilation, try and move around in well-ventilated areas, and take plenty of clean water. That's the most important, because hydration is going to be absolutely critical. So some of these things are going to be important. But even in our house, we must ensure that there is adequate ventilation so that we will be able to get relief from the free flow of air. So these are some of the precautions that people will have to take. And basically, in terms of ensuring that they also are conscious of the fact that extreme heat can result in strokes and heart attacks, they ought to not only drink enough water, but make sure that their blood pressure is also under good control.
You are a very important healthcare influencer globally and in India, and you also meet lots of policymakers. What's your sense of the understanding of policymakers on making healthcare system climate resilient?
Well, I think most people have now begun to realize the reality of climate change. There was a denial in policymakers across the world, then a bit of apathy and neglect because they started prioritizing other things and said, okay, climate change can wait. It's mostly the concern of the environmentalists. Let's focus on immediate needs of industrial development and urbanization and maybe some social sector programs. So they went about with turning their blind eye to environment. Now, in the last decade, it's become very clear that environment is going to be one of the biggest challenges now and in the future. and is going to really upset the apple cart of any developmental program that is being planned. So we do need to ensure that environment is given absolutely top-class priority. But I believe that it's not something that is either or priority.
Right.
Because we recognize that much of what we need to do in terms of environmental protection, in terms of climate resilient and climate smart food and agriculture systems, climate resilient and climate smart healthcare systems, climate smart and climate resilient urban development and transport systems, all of these are part of the general development program of any country. So only we need to make sure that we are also bringing in the climate smart and climate resilient element into it. So there is a convergence. They are not actually conflicting. We are not competing for different resources. We are actually bringing them together and seeing how best it can be done. And even going back to primary care, which we talked about a little while ago, it's one of the biggest generators of employment. When now we recognize that many sectors, industry and agriculture, are not able to offer the amount of employment because of mechanization, it is the health sector, particularly in primary care, which can offer a huge amount of employment and build up a health workforce. Both in India and globally, we have an opportunity to provide employment to a large number of young people, especially women. So our climate response and our developmental imperatives are very closely enmeshed together.
We have poor development indicators across the board, unfortunately. So how realistic is it to expect that healthcare could be much better?
Well, as I said, we should not counterpose development versus climate change response. Both have to go together. Because if we neglect climate change response, our developmental efforts will be stalled or hurt. So, you can't have a urban development when you are having floods and extreme weather events. You cannot have nutrition security when you have food and agriculture systems compromised by climate change. So I think what we must recognize is that both these are very much closely tied together and invest in both in a smart manner. And therefore, I believe that this kind of positioning, that both are different elements of development and both are sometimes conflicting because of resource requirements, is an incorrect positioning, because there's a tremendous amount of convergence between our other developmental efforts and our climate change response. So we ought to invest in both of them together. Like, for example, if we are saying that we are going to be building healthcare infrastructure now in response to our pandemic preparation and trying to improve our healthcare infrastructure, let's make it climate resilient as well as climate smart, so that the energy requirements are much less and the ability to withstand extreme weather events is much better.
You talked about the energy aspect of it. There's lots of pressure on Indian companies, and particularly even including healthcare sector, to adopt ESG. Do you think the healthcare sector is in a position to adopt ESG practices, or it's a bit too early for them?
No, it's happening now. We recognize that even the healthcare sector is not only a victim of climate change because of extreme weather events, destroying infrastructure, compromising transport systems, stranding healthcare personnel who cannot reach the hospitals or healthcare facilities. All of those are the effects of climate change on the healthcare system. But the healthcare system itself generates a large number of greenhouse gases. And in fact, globally, it is said that about 5.4% of all greenhouse gas emissions come from the healthcare sector. About 30% from the healthcare infrastructure in terms of energy utilization. But 70% from the supply chain. And therefore, if you can actually reduce the energy consumption in the actual healthcare premises, healthcare facility premises, but at the same time influence down the line procurement practices and resort to green procurement, you will be able to actually help reduce the overall greenhouse gas emissions from the healthcare sector itself. So I think the healthcare sector must be very proactive, and we are seeing initiatives happening. We are seeing within India itself, the Public Health Foundation of India helped to set up initiative in which we actually bring in a large number of hospitals together, and we have a health and environment leadership platform called Health, in which we have brought in a number of hospitals together, and we also have at the global level a big networking of hospitals being now coordinated by the World Health Organization. So I think the many healthcare facilities are responding to this challenge now, both by reducing their own consumption of energy and release of greenhouse gases, at the same time resorting to more climate resilient infrastructure.
We seem to be overall lagging on SDGs, but when it comes to healthcare, India seems to have a mixed kind of a record. What would be your major concerns on the SDG on health?
See, as far as the SDGs are concerned, we must recognize that the entire SDG agenda is a mixed bag. First of all, it carried over the Millennium Development Goals, which were incompletely delivered.
Right.
So from 2000 to 2015, maternal and child health and infectious diseases, which were prioritized, were not adequately delivered in most parts of the world. And then in 2015, in the Sustainable Development Goals, we added on non-communicable diseases, mental health, substance abuse, road traffic accidents, and other health problems. So we really expanded, which was necessary, which was absolutely necessary. So when we look at our own performance, we realize that having started work on the MDGs and having steered our National Rural Health Mission and later on the National Health Mission towards those prioritized areas of maternal and child health, some infectious diseases, and some nutritional problems, we did achieve some success. For example, our neonatal mortality rate, which was not really coming down, has come down, and our maternal mortality rate and infant mortality rate, under 5 mortality rate are well in the range of reaching the SDG targets by 2030, though we'll have to do a little more on neonatal mortality rate. But we also have started having a little more success in tuberculosis and other infectious diseases. Malaria, certainly in some parts of the country, especially Odisha, very good control has been achieved. But we need to do more in order to reach the 2030 targets. But my concern is not so much about the national aggregate indicator.
Right.
It is about the disparity between states. There are huge disparities between states. There are states which are performing very well as expected, particularly the southern states and some Western Indian states. But even the Niti Aayog has listed states which are not performing well on composite SDG indicators, especially health, like Bihar, Jharkhand, Arunachal Pradesh, Meghalaya, Uttar Pradesh, and Assam. So now we have to make sure that these gaps are bridged. Otherwise, our national indicators will also slip down. But more importantly, we just can't take pride that Kerala and Tamil Nadu are doing well and Jharkhand and Chhattisgarh are not doing well. And we have to really make sure that everywhere we perform well in terms of our SDG indicators. And the other element, of course, is what I mentioned is we have added on non-communicable diseases, mental health, and other areas. We haven't really started off very well on that. We need to pay much more attention to that. Otherwise, we'll slip up on those additional indicators. The carryover effect of our MDG efforts will be there for some part of the SDG indicators. But the add-on elements like non-communicable diseases, cardiovascular disease, cancer, respiratory diseases, and also mental health, they are not going to perform very well as expected because we haven't really framed a very strong program to be delivered for these.
And finally, what would be your message?
Yeah, I would like to add 2 elements, if I may.
Sure, sir.
One is, firstly, when we talk about the environment and we talk about planetary health, we talk in a vague manner, saying that we must protect the planet.
Right.
When people say, what do you mean by protecting the planet? You say, okay, let's avoid deforestation, let's avoid water shortages, we must avoid air and water pollution, and we must ensure that there is adequate biodiversity. Fine. But is there a measure? Interestingly, there is something called Planetary Overshoot Day, in which the composite resources of the Earth, the planet, and the ability to regenerate its resources every year are measured. Now, we do consume some of the natural resources every year. And even by the natural process of decay, some of the resources like plant life, they perish, animal life, they perish. But the nature has the capacity to regenerate most of it over the course of the year, provided we don't interfere and then start draining away a lot of those resources or placing barriers like deforestation, like excessive water consumption, and so on, or a tremendous amount of pollution. Now, the Planetary Overshoot Day, when it was estimated in 1970, it was the 30th of December. That means our budgetary deficit for the environment was only one day. But now, in 2023, it was the 2nd of August. That means our budgetary deficit, we are functioning on an environmental deficit. And that deficit has grown. And if the entire planet, if all of us had lived like Luxembourg, it would have been the 10th of February. If we had all lived like Qatar, it would have been the 14th of February. So the worry is that each year, the planetary overshoot day is receding. The planet's capacity to regenerate its own resources is now disappearing or diminishing. So what are we leaving for the future generation? Very little. So I'm very much worried, and my book is entirely geared towards our duty towards the future generation. We have to protect ourselves, certainly, but we have a moral obligation to make sure that we leave the planet in a healthy state for the future generation. And that's my first point. The second point is we are all connected. We are connected to each other. All our body systems are connected within the body, and they function with excellent coordination, unless we do something silly, like eating wrong kind of food and smoking. But similarly, human beings are all connected to each other. We are connected to nature. By not recognizing this connectivity, we are also causing a tremendous harm to the planet and to ourselves. John Muir, who was an Scottish-American naturalist, said, if you target anything in nature, you will find it connected to everything else.
Right.
And Martin Luther King said it even more beautifully. He said, basically, all men are caught in an inescapable network of mutuality tied in a single garment of destiny. He called this connectivity between all of us a single garment of destiny.
I see that.
And he said, whatever affects one directly affects all others indirectly. So I think it's absolutely necessary for us to recognize this harmony within our bodies, within our society, within our global community, and work together. And that we need to do, particularly not only to protect the current generation, but as a duty towards the future generation. So my book is essentially directed towards that.
So there's a wonderful message to all of us to look at the interconnectedness of the nature. And as they say that nobody is safe unless everybody is safe. So, right.
Absolutely.
Right.
And that's not only for humans.
Right.
It also means about other forms of life on Earth.
It was wonderful talking to you. Great, insightful conversation.
Thank you.
We hope you like this program. This program is also live streamed on All India Radio and aired on community radio stations. We look forward to your feedback on our WhatsApp number 9818120554. For participation in this program, write to us at sustainability.karma@gmail.com. You may also connect with us on social media. This podcast is also available on podcast hosting sites. Looking forward to meet you again at the same time next week with a new episode and a new guest. Till then, goodbye from all of us. Sustainability Karma, a podcast series with senior journalist and editor Rajiv Tikoo on sustainable development, sustainability and ESG.